Hello friends, welcome to my channel. I am Dr. Himanshu Gupta, and in this video we are going to discuss few points about anemia. And first I will be discussing you the questions and then I will post the answers. Do like my video and comment if you have any queries. So let us begin. Bone marrow cellularity. Fat cells to bone marrow cells ratio is myeloid to erythroid ratio is site of hematopoiesis from 0 to 3 months in fetus, from 1 month to birth. In RBC development, RBC first appears at which stage? RBC is first detected by staining at which stage? Nucleus is removed at. Normal value of RDW is what happens to its value in thalassemia. Hereditary spherocytosis most common mutation is mutation that correlates with severity. Test for hereditary spherocytosis. Heinz bodies are seen in mutation seen in PNH. Warm antibody type antibodies are cold agglutinin type antibodies are antibodies in cold hemolysin type are called as. You will think the answer in your mind. Sickle cell anemia mutation is Howell Jolly bodies are seen in Cooley's anemia is another name for pathognomic in beta thalassemia major is HBH disease is HB Barts is acanthocytes are seen in. So now friends, I will tell you the answers. Bone marrow cellularity. Fat cells to bone marrow cells ratio is 1:1. Myeloid to erythroid cell ratio is 3:1. Site of hematopoiesis from 0 to 3 months is yolk sac. From 1 month to birth it is liver. Hemoglobin first appears at pro-erythroblast stage. Hemoglobin first detected by staining is at which stage? Intermediate normoblast stage. Nucleus is removed at which stage? Late normoblast. Normal value of RDW is 11.5 to 14.5. What happens to its value? It remains normal in thalassemia. In iron deficiency anemia, its value increases. Hereditary spherocytosis most common mutation is unchirin mutation. Mutation that correlates with severity is spectrin mutation. Remember that glycophorin does not take part in pathogenesis of hereditary spherocytosis. Test for hereditary spherocytosis is osmotic fragility test. Normally the cells start osmotic fragility test starts at 0.5% NaCl concentration, but if it starts at a concentration more than 0.5%, then it is positive for hereditary spherocytosis. Heinz bodies are seen in G6PD deficiency patients. These patients are resistant to which infection? Plasmodium falciparum infection. Plasmodium falciparum infection. Mutation seen in PNH is PIGA gene. PIGA gene. This gene codes for glycophosphatidylinositol anchor proteins, which anchor proteins such as CD59 and CD55. CD59 is membrane inhibitor of reactive lysis, and CD55 is decay accelerating factor. Due to the absence of these proteins, these RBCs get easily lysed by complement proteins. Basically, these proteins protect the RBCs from its lysis by the complement proteins. So when these are absent, there is easy lysis of the RBCs. Immune hemolytic anemia. Warm antibody type antibodies are IgG or IgM? IgG. Warm antibody type is seen in CLL, SLE, rheumatoid arthritis. Cold agglutinin type antibodies are IgM type. It is seen in mycoplasma infections. Antibodies in cold hemolysin type or paroxysmal cold hemoglobinuria is Doneth-Landsteiner antibodies. Antibodies in cold hemolysin type are Doneth-Landsteiner antibodies. Mutation seen in sickle cell anemia is glutamic acid is replaced by valine. On the 6th position of beta chain. Howell-Jolly bodies are seen in sickle cell anemia, severe hemolytic anemia, hereditary spherocytosis, and myelodysplastic syndrome. These are Howell-Jolly bodies. Cooley's anemia is beta thalassemia major. Pathognomic in beta thalassemia major is target cells. So this is how target cells look like. What is the test for beta thalassemia? It is Nestrov test. Naked eye single tube RBC osmotic fragility test. No lines are seen in a thalassemia patient and lines are seen in normal patient. This is because the membranes of the RBC are stable in thalassemia patient. HBH disease is by 3 alpha chain deletion. And it results in tetramer of beta chains. HB bars are 4 alpha chain deletion. And it results in gamma 4 chain polymer. Acanthocytes are seen in DIC and A beta lipoproteinemia. A beta lipoproteinemia. These are irregularly spaced cytoplasmic projections. When these cytoplasmic projections are regularly placed and they are called echinocytes, and they are seen in uremia and microangiopathic hemolytic anemia. Now friends, we will discuss the differences between iron deficiency anemia and thalassemia minor. One point we have already discussed: the red cell distribution width is increased in iron deficiency anemia and it is normal in thalassemia minor. And Menzer index. What is Menzer index? Menzer index is MCV by RBC. So as the number of RBC decreases in iron deficiency anemia, the Menzer index is more than 13, and the number of RBC increases in thalassemia minor, so Menzer index is less than 13. Now we will see a few points of how to differentiate iron deficiency anemia, anemia of chronic disease, sideroblastic anemia. So let's see. You will see that in iron deficiency anemia, the serum iron decreases, because obviously it is iron deficiency anemia. The storage of iron also decreases. Hepcidin, I will tell you, in anemia of chronic disease. In anemia of chronic disease, basically in anemia of chronic disease, the hepcidin production increases. This hepcidin prevents the release of iron from the macrophages. So basically what is happening is that there is iron, but iron is not able to come into the circulation. So the storage of iron increases, but serum iron is decreased, and hepcidin production increases. In iron deficiency anemia, because now there is shortage of iron and we have to bind to any available iron, so the transferrin production increases, and so the total iron binding capacity also. In sideroblastic anemia, what is happening is that iron is not able to combine with the protoporphyrin. For heme synthesis. Okay, so the serum iron is increased. When the serum iron is increased, the serum ferritin will also increase, but it has little to do with hepcidin. So basically you have to remember that in sideroblastic anemia, iron is not able to combine with protoporphyrin. So heme synthesis is decreased, and in this iron is increased, protoporphyrin is increased. And you will remember that in sideroblastic anemia you will see Pappenheimer bodies. Okay friends, and in thalassemia almost all these things remain normal. Okay friends, hope you enjoyed the video. Thank you.